At the onset of labor, the contractions are usually of low intensity. You can even talk during a contraction. Often, they are irregular and do not last very long. The onset of labor, during vaginal delivery, is most often spontaneous. It is marked by the occurrence of contractions which, over the hours, will become more and more intense and regular, sometimes associated with the rupture of the bag of waters. Around the time of birth, the sac of amniotic fluid, known as the sac of waters, that your baby has been bathing in for months ruptures, causing a clear discharge called waters breaking. This rupture can take place spontaneously, from the start of labor. If the bag of waters has not broken spontaneously, the midwife may decide to provoke it, when labor is already advanced. There comes a time when you feel the work progressing. The contractions are painful and they get closer, longer and more intense. We then speak of the active labor phase. The cervix is thinned, or erased, and it is open, or dilated, by about 3 to 5 centimeters. Then, the force of the contractions gradually increases and the cervix gradually opens up to 10 centimeters, complete dilation. At 8 or 9 centimeters, the contractions are often very painful. They are at their highest intensity just before full dilation of 10 centimeters. The baby's expulsion phase is relatively short and only lasts about 30 minutes. When the cervix is fully open, cervical dilation then reaches 10 centimeters, and the baby's head, the widest part, is well engaged in the pelvis. The midwife or obstetrician asks you to push. These thrusts, during contractions, allow the expulsion of the baby. The head is out, the baby's body slides easily. Your baby is born. The midwife cuts the umbilical cord, checks your baby's vitality and lays your child against you. The delivery does not really end until 20 to 30 minutes later. Under the effect of new uterine contractions, the mother expels the placenta. This is called deliverance. First sounds. It will be deposited on you. Healthcare professionals will dry your baby while assessing if he is doing well. When necessary, they will remove secretions from his nose and mouth. If you and him are fine, he will stay on your chest in skin-to-skin contact. Ideally, your baby would stay there without any separation for a minimum of 2 hours. Under a warm blanket, you can hug your baby to you. Now is the time to get to know him.